Hello, this is Dr. David Green, CEO of the Washington Pain Network. The topic today is what you need to know about acute and chronic back pain. Over 90% of Americans will experience back pain at some point. Regardless of whether or not you ever get treatment, 90% of that back pain gets better within 6 to 12 weeks. However, an unfortunate few will end up with chronic back pain. Acute pain is described as 6 weeks or less, subacute is 6 to 12 weeks, and chronic is over 3 months. Back pain is the second most common reason for doctor visits behind the common cold. Half of all working Americans admit to having back pain each year. Back pain is the most common cause of disability around the world, with the direct and indirect cost costing about $100 billion. There are both soft tissue or hard tissue, meaning bone, causes of back and leg pain. The most common by far is the back sprain or strain. You are moving, you're doing a weekend warrior activity, when you sprain or strain your back, meaning that either a ligament is injured, a tendon, or a muscle, that's the most common cause. When you look at the disc, it has two components, and that's akin to a jelly donut. The outer part is the harder part of the donut called the annulus, and that has nerve endings. So if it's torn, it can feel pain. The inner jelly part, the nucleus pulposus, has no nerve endings and therefore does not feel pain. When you have disc degeneration, such as you see here with some bulging and loss of height, that can have some tears here and cause pain. You can see a tear in the disc such as this. That can be painful. Now, if this is a big tear and you have some inner jelly part that squeezes out, you can actually get irritation of a nerve root. That's called sciatica. Okay. Now, sciatica, you have 3 nerve roots that come together to make up the sciatic nerve. The back pain may go down the leg pain may go down the back of the leg or the side of the leg. It just depends on which nerve root is being pinched. Okay. Arthritis, number one cause, bony cause of back pain. Arthritis occurs in people as we age, just like it does in the hip or the knee. You have joints in the back of the spine called the facet joints, and those can become degenerative and cause pain. Sacroiliac joint, we have 2 of those at the lower end of the spine on the left and the right. Now these can become inflamed. They have cartilage just like any other joint. Okay. Generative scoliosis occurs mainly from arthritis and disc degeneration. It can also be a remnant of adolescent scoliosis, but essentially this can lead to back pain due to the degeneration in the arthritis. When you look at spondylolisthesis, that's when one vertebrae slips on another. That can be painful because it can actually pull the nerve root that's trying to get out right here. It can pull it forward and cause traction with sciatica. And it can also cause back pain due to the weird positioning and the degeneration. Spondylolysis is actually a stress fracture in one of the vertebrae. Okay, that can be painful. And then spinal stenosis is one of the most common things as we age, where you get arthritis and overgrowth of bone. You see it here as well, and it's pinching the nerve root as it tries to get out. That typically occurs at multiple levels, and it can cause buttock pain, leg pain, aching. Uncommon causes of back pain include infection, fracture, or tumor. Now, I say uncommon, but over 700,000 spinal compression fractures occur each year. Okay, a lot of those are silent. They don't cause any back pain, but it can cause significant aching and pain as well. The top non-operative pain management in the state of Washington is through the Washington Pain Network. There are several clinics throughout the Seattle and greater area. Over 50 insurances are accepted with over 25 treatment options being provided. Over 90% success rates are achieved at these clinics, which means getting pain relief and getting patients back to work and avoiding surgery. The pain doctors are board certified and award-winning. Visit us online today at WashingtonPainNetwork.com and then call us at 877-877-8556. I'm Dr. David Green with the Washington Pain Network. Your pain stops here.